Hard to believe, but the CDC, they report that 1 in 10 Americans over age 12 takes antidepressant medication, while millions more take anxiety meds. Now, on today's show, we'll be joined by medical experts who will answer your questions and offer tips on how to best manage treatments for depression and anxiety. Now, that is all coming up on this episode of Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hello and welcome to Ask the Doc. No appointment needed. This is the show where the health questions that you send in are answered by our doctors and medical experts. I'm Julie Donaldson. Thanks so much for joining us today. Now, we're very pleased to be joined by Dr. Madeline Camejo, Vice President and Chief Pharmacy Officer at Baptist Health South Florida, and Michelle Krichbaum, the Clinical Manager for Pain Management and Palliative Care for Baptist Health South Florida. Ladies, thank you so much for your time today and for joining us. We have some great conversations to get to.
Thank you for having us, Julie.
Yes, thank you, Julie. Glad to be back.
So many questions have come in about this topic, and it goes to show just how important this is to a lot of people in their daily lives. And first, we have Lawrence. He mailed in as he asks, my wife and daughter, they're both taking anxiety meds, and thankfully they seem to be helping. But can you talk a little bit about the advances made when it comes to antidepressants and anti-anxiety medications? Now, Lawrence, thanks for writing in here and for the concern you have for your family. But before I do turn to Dr. Camejo for her answer, let's watch this short video from the Mayo Clinic on teen and adult depression. Here it is.
Whether you are 13 or 30, anyone can be affected by depression.
It's a very real diagnosis, and it's different in adults and kids.
A typical adult symptom may include the classic depressed mood, says Dr. Marcy Billings.
In a child or adolescent, you might see more irritability, cranky behavior, isolative behavior.
The challenge is that it can also be typical teen behavior. Dr. Billings says it's the change in their normal behavior that can be concerning.
They used to want to hang out with friends, now they're not. Grades are suffering. They're struggling to get done what they normally do every day. They're tired all the time. They can have sleep problems. They can have eating problems.
Weight loss in adults is a common sign of depression, but can be different in kids.
You might see that they're not gaining weight appropriately.
Or they are gaining excess weight. The good news is that there are treatment options for adults and for children. A good place to start is talking with your primary care provider.
We can treat adolescent depression extremely well.
For the Mayo Clinic News Network, I'm Jason Howland.
Hey, Dr. Camejo, that's a good explanation on just what so many people are dealing with, no matter the age. So let's start there with you. Depression, anxiety, it's an issue a lot are dealing with. Let's talk a little bit about the advances made by scientific community with these medications.
So over the last decade or so, a few newer antidepressants have come out that work a little differently than the older ones that people are used to, like Prozac, Zoloft, or even Lexapro. So the first one is esketamine, which is more like they call it Spravato. It's a nasal spray used for treatment-resistant depression. It wakes up parts of the brain that have gone quiet and that have gone quiet in depression by blocking a brain signal called NMDA. And this helps the brain form new connections more quickly. It also works much faster than antidepressants, sometimes within hours or days instead of weeks like some of the older ones do. The next one is Availability, and it is a combination of two medications, bupropion and which is used for smoking, to quit smoking, and dextromethorphan. Now, those are very different doses used in very new ways. And these medications do affect glutamate and NMDA receptors, which are part of the brain system, and that's what it works on. And like esketamine, this drug also tends to work faster than the traditional antidepressants, sometimes as quickly as 1 or 2 days. The last two medications that are specifically for postpartum depression is Brexanolone. It's an IV medication, and Zuranolone, which is in pill form. These medications act like a steroid hormone that the body naturally makes during or after pregnancy called GABA. And this really helps quickly reset the brain's calming signals. Even with the pill version, the course of therapy usually is only about 2 weeks now.
I think that's something that's going to be really helpful to Lawrence and so many others. As you hear, you get on this medication, then it's not kicking in, and maybe they have a hard time sticking with it because it takes a while to take effect. I like hearing that something can come and it can see the results more quickly than we have in the past.
So are we, Julie. So are we.
Correct, because a lot of these meds sometimes would take almost 4 to 6 weeks, and people would
Yeah.
get off their meds and they didn't want to take them. So it's really important that the newer meds are working faster so people see the results quicker.
And then you listed so many as well. So it's important to make sure you do go to your doctor to see which one of these is going to be right for you. As we go on to more questions, we'll get even further into that as well. So, Dr. Krichbaum, this next one is from Wanda, and she writes that I've been prescribed anxiety medication. My doctor said he is giving me a newer medication. Can you talk a little bit about how these new meds differ from the older ones as far as effectiveness and side effects? So, I already heard that they can come into play sooner, but we know there's more to it than that. So, Dr. Krichbaum, I'm sure many people have this same question. Tell us a little bit about their new effectiveness and the side effects.
Sure. So your doctor mentioned a newer anxiety or depression medication. So that probably means something like Vibrid, Trintellix, or even Auvelity that Dr. Camejo just spoke about. So these work a little bit differently than the older ones like Prozac or Zoloft. So Prozac and Zoloft are SSRIs, and they're a little bit of an older med, but the SSRIs and SNRIs, they're still very reliable meds, but they can take weeks to kick in, like we were just talking about, and they don't work for everybody. So the newer ones are trying to cover that gap. So for example, Trintellix might not help just mood, but also kind of brain fog and concentration. Vibrid's goal is to be as effective as an SSRI, but with possibly fewer sexual side effects, which can be a very big deal to a lot of our patients. And then Auvelity, we just mentioned, is the first pill that can start working in just days rather than taking weeks. So this is kind of a big deal when you need that relief faster, like we were saying. So traditional meds often cause things like sexual dysfunction, weight gain, or kind of feeling flat. So the newer ones still have side effects, but they can look a little bit different. So Vibrid may cause some stomach upset, but tends to be lighter on the sexual side effects, like I mentioned. Trintellix's most common problem is nausea. And then Auvelity can cause some dizziness and changes in blood pressure, but it's less likely to cause sexual problems as well. So in short, the new medications, they're not necessarily stronger, but they're designed to be a little bit smarter. So they can work a little bit faster, they can target additional symptoms, and they have a different side effect profile.
Side effects are so important as well. As like you're trying to fix one thing that, but maybe it does cause something else, and you have to value that and weigh that to see which is going to be best for you as well. As again, as there's a lot more options, which we're welcoming these days, to help people get through things. Now, our next question, it comes from Val, who reached out through Facebook, and she writes, my friend was prescribed ketamine to help treat her depression and, more importantly, her pain. And I was really surprised to hear that because I had heard that it was a very strong medication. Is that a new treatment, and how safe is it to take? Dr. Camejo, let's talk a little bit about ketamine as a prescribed medication.
So ketamine is actually an old medication that we have found additional uses for. At higher doses, we actually use it for anesthesia. It's what puts you under while people are going through surgery. But research has found that at much lower doses, it actually benefits for both pain and treatment-resistant depression. As I previously mentioned, Spravato, which is a modified version of ketamine. Ketamine is really designed to be administered in a clinic. And as for pain, a new ketamine product now called KedRx was just approved by the FDA that is for treatment for post-surgical pain. As ketamine's safety profile at high doses like to be in the operating room, ketamine is a powerful and can cause hallucinations or make you feel very disconnected. At the lower doses used for depression and pain, it's generally safe, and if it's given under the right medical supervision, people usually actually are monitored in a clinic while they get it. So the side effects tend to be things like dizziness or nauseous, but that usually wears off as soon as the treatment is completed. It's not something people do or take on their own.
Is this a drug that we've heard has been abused and misused in the wrong way?
Yes, and Michelle, who's an expert in ketamine, yes, when you talk about Matthew Perry, when used incorrectly, it can hurt people. But Michelle, what are your thoughts on this?
So I love ketamine as a drug. I use it only in those low doses, so I don't do anesthesia at all. But we use it in our sickle cell pain clinic, and we have had some really great results with it. I've seen it be very effective in the depression space as well. The thing with something like Matthew Perry, unfortunately, he was being overprescribed that medication. There were some expected harms that were coming from that. He wasn't in a monitored setting. He was at his home, using it on his own. So that's not the appropriate way to use ketamine. That's not how we're using ketamine, and that's not how your physician is going to prescribe it either. But it can be really, really effective, especially for people who have treatment-resistant depression and other medications they may have tried have not been effective.
I think when you hear what happened to Matthew Perry with this, folks are thinking maybe they're taking this recreationally, they're abusing it. And that's where the reputation of becoming such a strong drug, which is why she has a concern for her friend taking it. But it's nice to hear that it's not something to necessarily be afraid of, monitored properly and used in the right ways as well.
And it should always be administered in a clinic, never, never at home alone.
Always, right? Always. Okay. No, we're just getting started here, folks. We still have time to answer your questions. So here's how you can send them in.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Let's keep it going. Our next question comes in from Christine, and she writes, ever since COVID, I feel like I'm in a fog. I'm anxious all the time. And the weird part is I never was before. Well, based on what you said earlier, I know I'm not alone. I'm starting to think that maybe I need to take meds to calm me down. So what should I do? Dr. Krichbaum, we talked earlier about how many people feel like Christine, especially since COVID, is that just had such a huge impact around the world. So what can you tell her?
So, Christine, you're definitely not alone in feeling that way. A lot of people who had never had anxiety before started experiencing it after COVID. So, there was stress, isolation, health worries, even the effects of being sick. If you caught the virus, it makes sense that your mind and your body may feel a little bit off. The brain fog and constant anxiety are very real, and you're not imagining it. So, as far as what to do, the first step is to openly talk with your physician or a mental health professional that can help you figure out which medications may be helpful, or if you may take other approaches like therapy, lifestyle changes, or even short-term supports could really make a difference. If medication is an option, there are both older and newer ones that can be tailored to your needs with the goal of calming your anxiety without making you feel numb or just like you're not like yourself. It's also worth remembering that meds are only one piece of the puzzle, especially with anxiety. So things like therapy, regular exercise, good sleep, and stress management tools can really boost how well that medication works. So the bottom line is you are not alone. There are safe and effective options, and reaching out is an important first step.
Always say that for folks that feel that they're alone, if they can get into a world where they realize others are experiencing the same thing, that's really the first step. And then you can have an open dialogue on maybe ways that can help you get over this, because everybody experienced COVID. Nobody escaped that. And we all deal with it differently, even though the world's back to normal, doesn't necessarily mean we are. And that's okay to seek help for it. And that kind of goes to our next question here as well, where we hear from Travis as he writes, I was let go from my job recently due to downsizing. And I know it wasn't anything that I did, but I do find myself both anxious and depressed. Do these medications work well together, or are doctors forced to treat one symptom but not the other? That sounds tricky, Travis. So thank you for your question, Dr. Camejo. What can we say about the interactions between meds when it's a little bit more complicated?
Yeah, and I'm really sorry that you're going through that, Travis. Losing a job, especially when it's not your fault, can shake your sense of security and bring on a mix of anxiety and depression. And the combination of having both the depression and anxiety is very common. About 50% of patients with depression also have anxiety. So the good news is that most medications used for depression also help with anxiety. So doctors aren't stuck with choosing one over the other. For example, medications like we talked about, the SSRIs like Zoloft and Lexapro. The newer ones like Treletex is often used when someone has both, and they target the same brain systems that influence mood and worry. So you don't usually need to separate the prescriptions just to cover both sets of symptoms. And sometimes if anxiety is especially intense, a doctor might add something short-term like hydroxyzine, or in certain cases, a low dose of benzodiazepine while we're waiting for the main medications to kick in. So both overall approach is to the treatment is good. So both at once, not to choose one over the other. So in short, yes, these medications can work well for both anxiety and depression, and your doctor will likely tailor the plan so you're getting relief from both.
What about in a situation where you're going through something and it's just a season as opposed to maybe like something that we know lasts lingers for years? Is there different medications that could bridge a gap that maybe not be as addictive to where now you're on them for forever?
At times I think the first thing you do, if you think is this is only seasonal, maybe speaking to a psychologist or somebody to help you get through that time, maybe not put you on medications right away. But usually, these doctors will try to get you through what I call therapy first before they actually start putting you on medication. So it all depends on your symptoms and how long, it would be what they would evaluate the patient on.
All right. Well, thank you. Let's get to our next questions. We're going to hear from Jackie. She writes, this may sound like a strange question, but are there foods I should eat, or more importantly, foods that I should stay away from that make depression and anxiety worse? Now, I love this question. I believe that there are things that can impact us, but let's get to the expert, Dr. Krichbaum, talk a little bit about the role that diet plays in depression and anxiety.
So there has been some really great recent research on the role of the gut and its effects on different mood disorders, including depression, anxiety, chronic pain, or even autoimmune disorders. So changing your diet is not going to be a cure-all for depression or anxiety, but it can sometimes support or even worsen symptoms. So let's start with the foods that might make things worse. Alcohol. It feels calming in the moment, but it is a depressant and it does affect your mood, and it makes sleep worse because it affects your REM cycle inappropriately. The next one is caffeine. So I know this is South Florida and we all start our day with a cafecito, but coffee, energy drinks, lots of soda, too much can affect your sleep and make you feel like your heart is racing, and that can increase your anxiety. Highly processed foods with too much fat or sugar, so fast food, your chips, your packaged sweets, they tend to cause these blood sugar spikes and then crashes, and that can worsen your fatigue. So let's talk about some foods that may support your mood. So omega-3 rich foods. So this is your salmon, your tuna, your walnuts, flax seeds. These are linked to better brain health and lower depression risk. Fruits and vegetables have antioxidants in them and nutrients, and that helps support brain function. Your whole grains, so your oats, your brown rice, your quinoa. This helps keep your blood sugar steady, which helps with mood stability. Lean protein, so chicken, eggs, beans, tofu, they actually help make neurotransmitters like serotonin and dopamine. And then finally, fermented foods. So yogurt, kefir, kimchi, sauerkraut, they support gut health, and that's increasingly tied to mood and anxiety. So there isn't a single anti-anxiety or antidepressant diet, but if you eat more whole, unprocessed foods and try to limit caffeine and alcohol and excess sugar, it can make a noticeable difference for a lot of people.
I think it goes down to you have to be careful of what you are putting in your body, and you're putting medications in. You want to make sure that you're feeding your body the right foods to work with that as well, and the impact that it can have. So don't dismiss that. Very good question. That I like that one. This next one comes from Mike. He reached out on Instagram and says, my son was diagnosed with Tourette syndrome as a young man. Now the medication he was given, it helped, but it also made him gain a lot of weight. And now we are dealing with anxiety and depression along with Tourette's. Now, in some ways, these side effects, they're harder to deal with than the original diagnosis, and I don't know what to do for him anymore. This is a very difficult question. We're so sorry, Mike, to hear what your family is struggling with these issues. And it sounds like a question that maybe some viewers might have in this situation. Dr. Camejo, what can we tell Mike?
That sounds really tough, and it makes complete sense since you feel worn out trying to help him through all of this. And you're not alone. Many families dealing with Tourette's face the same challenge. The tic themselves can be manageable, but then the side effects of the treatment add a burden of anxiety or depression can really feel overwhelming. So a few important things to know. It's very common for people with Tourette's to also have anxiety, depression, or even ADHD. And sometimes those conditions end up causing more daily stress than the tic themselves. So it's not unusual that your son is facing this combination and it's part of a broader picture of Tourette's. It's not a personal failing. So as your son's medications, some of the older meds for Tourette's, like certain antipsychotics, can reduce the tics, but it also causes issues with weight gain, fatigue, mood changes, The good news is there are newer medications that have different approaches that can control sometimes the side effects. And for example, the doctor sometimes uses medications in lower doses, trying different classes like an alpha agonist or even newer antipsychotics, or a shift focus to treat the anxiety and depression alongside with the tics. There is also non-medication therapies like comprehensive behavioral intervention for tics, which is a structured therapy that can teach ways to manage tics without relying solely on medication. That kind of therapy can also help with anxiety and depression that he's experiencing. So it may be worth talking with his neurologist or his psychiatrist, but reassuring and reassessing his current medications to see if adjustments can be eased to help ease the side effects, adding specific treatment for anxiety or depression, whether it's the therapy, medication, or both, and consider a referral to a center or even a clinician that really specializes in Tourette's, since they'll be most up to date on balancing the tics, moods, and side effects. But you're right, sometimes the side effects can feel worse than the original diagnosis, but there are other options out there with the right team and the approach. Many people find Tourette to be a better balance between system control and quality of life.
Definitely a difficult situation to have to navigate. Thank you for helping give some wisdom throughout that. Now, we just got another question in from Rachel, and this time it comes from our Facebook page. She writes, "My doctor is telling me that changing some of my daily habits, like walking more and eating healthier, may make me feel better, but I'm not sure that that will help me with my anxiety. So what do you think? What changes would you suggest?" Dr. Krichbaum, I've heard for years that eating better, as we just heard from you, and getting some exercise, it will help with depression and anxiety. What do you add to that?
So this is a really fair question, and I hear it a lot because when you're feeling really down or anxious, being told, oh, just walk more and eat better and eat all those foods that I just mentioned, it sounds way too simple, but can also seem really overwhelming. So there is really good science behind it. And what I would say to do is just start small with small steps and make tiny changes and then start to add from there as you start to feel better. Because these kinds of changes, they don't replace therapy or medication, but they can make a real difference in how your brain and your body handle stress. So here's a few daily changes that have the strongest evidence for helping with anxiety. So do a regular activity that you enjoy and not just exercise for exercise sake. So if it's a 20 to 30-minute walk most days, that can lower stress hormones and boost calming brain chemicals. So it doesn't have to be the gym or biking or dancing, but like yoga, even just stretching counts. So maybe you just start off with only 5 minutes a day and then you build from there. So try to have a consistent sleep routine. So anxiety gets worse when you're running on empty. So aim for a regular bedtime. Try to keep your room cool and dark when it gets to be that time of the night when you're going to bed. That often helps people feel calmer. Same with cutting back on caffeine, like we talked about earlier. And then also try to take some breathing or relaxation breaks. So short, simple things like deep breathing, mindfulness apps, which I use one myself, or even 5 quiet minutes outside can train your body to kind of switch off that fight or flight mode. And finally, isolation fuels anxiety. So making time to talk with your friends or your family or your support group, it gives your brain a sense of safety and belonging. So these are not going to cure anxiety, but together they can take the edge off and make treatments like therapy or medications work even better. So you think of them as giving your brain and body a calmer foundation to build on.
I think it's good right there. You talk about the isolation. It's if you can get outside and maybe again find a connection with somebody. I always say working out, it's great physically, but it's always more important mentally. Whenever you're going through something, there's just something that kicks in that really helps. So one extra little thing that you can do to help yourself when you are in these situations, along with everything else we've already talked about. And we have another question as well. This one comes from Sergio. He emailed in. I, like many other people who struggle to manage my depression and anxiety, my question is about side effects. What are some of the side effects that people most commonly report, and how do your pharmacists help them manage those without discontinuing treatment? So, Sergio, thank you for writing in. Such a good question. We talked about earlier the side effects from different meds, and how does it that pharmacists help people manage the different side effects, the interaction between different medications? Dr. Camejo.
That's an important question because a lot of people do well on depression and anti-anxiety medications, but side effects can make you feel discouraging. The good news is that many of them can be managed without stopping the medication altogether. Talking to a pharmacist is great. They can always help you with those help you manage the side effects, and even call out your doctor if you're having issues. But one of the most important side effects, a lot of my patients tell me about are GI related nausea or diarrhea. Your gut has a lot of serum, what they call serotonin receptors. So medications that boost serotonin often stirs up a lot of things at first. What helps is taking medications with food at low doses, going up slowly, shifting the time, like bedtime instead of morning can ease some of the symptoms, usually after the first couple of weeks. The seconds are sleep changes, which could be either feeling restlessness or wired and having trouble falling asleep, or the opposite, people feel too sleepy. So talking to a pharmacist, helping you change the timing of your medication, also taking doses in the morning if it's keeping you up at night, is really going to help you. So also maybe even flagging interactions with caffeine. But it really is a great time to talk to a pharmacist when you're having those side effects.
Such an important conversations that we've been having today. I feel like we could continue going on and on and on, but unfortunately, well, it is all the time that we do have for today. So Dr. Camejo and Dr. Krichbaum, thanks so much for your time and incredible insight. And thank you all for joining us and sending in some really important questions. I'm Julie Donaldson, and we will see you next time on Ask the Doc. No appointment needed. Stay safe and be well.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.